Healthcare and senior care is fraught with problems and challenges, but we're also seeing some amazing new clinical treatments and resources. This show will help illuminate and uncover the good, bad, the ugly in order to equip patients, families, and other healthcare providers. Welcome to Senior Care Confidential.
Good afternoon. We have a great guest today. How are you doing, Brian?
I'm doing
today
great.
On this beautiful Tuesday in February. We've got an awesome guest. I was at a conference a couple weeks ago, and I met a marketing director for a company called Flying Angels, and it's nurse-owned. It's a company that flies patients injured, hospice, maybe terminal, to their home of choice, where they want to be. And Bob Bacheler is the managing director of Flying Angels. He is an RN. One thing great about being a nurse, there is so much we can do as registered nurses. He specialized in non-emergency transport on commercial airlines with over 30 years of clinical experience, or clinical nursing experience, including 20 years as a flight nurse. Bob leads a team that ensures expert care for patients worldwide. Bob holds a director of nursing practice. His certifications include critical care registered nurse, certified flight registered nurse, and certified dementia practitioner. He has a travel health certification from the International Society of Travel Medicine. Welcome, Bob.
Wow.
Joe, Brian, it's an absolute pleasure to be here. Thank you for having me.
Let's talk about Flying Angels. Just what do you do? Just tell us all about your company.
Sure. What we do here at Flying Angels is we have doctors and nurses who accompany people who have medical needs on the commercial airlines, Delta, American, United, both domestic and international. International, we're talking about flying on Lufthansa, Qatar, Emirates, Air China. So we're transporting people who have medical needs, need to get long distances, don't necessarily need the ICU level of care of an air ambulance, a private jet, but can fly with a nurse on a regularly scheduled commercial airline.
That's amazing. Yeah. So who pays for this? Does Medicare, Medicaid?
Unfortunately, insurance does not pay for this at all. It's almost always private pay. And one of the reasons that people are seeking out our service is insurance is not going to pay for an air ambulance either. So to fly somebody on a commercial airline is a fraction of the cost. And when it's a private pay situation, every dollar counts. The only exception that I will throw in there is we do some work with travel insurance companies. And if people travel overseas, I always recommend that they purchase a good medical travel insurance policy, and that will cover their medical expenses if they're injured overseas. And in the event that they're injured and need to be repatriated back to the United States, the insurance company will call us and say, hey, we have a woman who broke her leg traveling in Milan, Italy. Go get her and bring her back.
Okay.
But for the most part, it is all private pay.
Okay.
Wow.
What's your typical client look like, or family?
Well, we have a couple different types of clients that we have. A majority of our clients are grandma who has some dementia, has some mobility impairment. She might be on oxygen, that is living in Spokane, Washington, and the family is scattered across the country, and they want to fly her to an assisted or skilled nursing facility in Florida. The family could probably do it themselves if they really wanted, but it's a lot of times it's just easier to call us. We arrange for bedside to bedside transport. We pick grandma up where she is at her facility and then fly her on a commercial airline to where she needs to go and take her from the airport to her facility.
Those door to door.
Bedside to bedside, door to door.
There you go. Yeah, bedside to bedside.
Awesome.
Yeah, that's awesome.
And then we also do transports for spinal cord injury, stroke patients, traumatic brain injury patients who get injured and are being transported to the centers of excellence around the country. One of the interesting things about insurance is it'll often pay for people to get rehabilitation at these centers of excellence, but it won't pay to get them there. So that's why the families will reach out to us.
I gotcha.
Well, it's interesting. And this has been several years ago. And I owned a home care agency. And we got a call from a hospital here. A patient was in Kenya and she was on a safari. She had saved for years for this safari. And she got out of the van and there was a 1 in 3 million chance. But she was charged by a buffalo and broke her neck and had to be transported back. And I would have had no idea,
how to navigate that.
Yeah, how she got back. But anyway, so let's talk about, say, somebody that's on a vacation and something catastrophic happens. Say they didn't get that travel insurance or, so just talk about something like that. If you've had some examples.
It's an unfortunate scenario that is pretty routine for us. We will get a call from somebody who is in that exact situation with skiing in the Alps or injured themselves on the safari, which we have had happen. And they find themselves in the hospital in the foreign country. And we will work with the facility to just kind of navigate through their healthcare until they're ready to come home. And then we will send, one of our nurses, 2 of our nurses, 1 of our doctors, depending on what's clinically needed out, pick them up and then fly with them back here to the U.S.
Wow, that's incredible. Yes. We have a couple pictures, I think, Jordan, of some examples of patients. And I know we talked before the show. So traditionally, I shouldn't say traditionally, but for domestic flights, you guys are doing it. They have to be able to physiologically be able to tolerate sitting up in one of the chairs. But for international flights, like we have a picture there, they can actually fold down a few rows of chairs to actually do stretchers.
That is correct. That first picture was a gentleman that we were transporting on an international flight on a stretcher. One of the things I do want to stress is for domestic flights, there are no stretcher options. This particular person is in one of our custom reclining wheelchairs. A lot of times, a lot of the time of the transport is not necessarily on the plane, but at the airport, getting somebody to the airport. So for those people who find it difficult to sit up, now this gentleman here obviously is enjoying his sitting up in the first class.
Yes, he is.
On a domestic flight with our nurse.
He looks so happy.
A lot of times people cannot sit up for extended periods of time. So we're going to wind up, having them reclined in our reclining wheelchairs, while we're getting them to the airport, while we're getting them through the airport. So this way, they can lie back. And the only time they really have to sit fully upright, again, one of our patients in one of our reclining wheelchairs that we can lie back. So this way we can transport them kind of in a reclined, comfortable position all the way to the airport and all the way through the airport. The only time they really have to sit completely upright is when they're actually taking off and landing, which can be, 10 to 15 minutes. And our international flights, we're routinely transporting patients in lie flat business class. So, we can get them into their seats, and then sit them up for takeoff, and then they can recline and lie flat for the 18 hours of the journey, however long it takes.
Yeah, I was going to ask on that, on the commercial flights, are you guys traditionally flying them on like the business coach or business or first class so that they recline and have a little bit extra room?
First class domestically, business class internationally. Yes.
Got it. Okay.
And this is a funny question, but I have flown with clients before and I've just prayed that they don't poop while they're on the flight. So if they have to use the restroom, like your staff has to go in there with them a lot of the times, I'm sure.
We have protocols for all of this. And
he says he's smiling. Yeah.
We have somebody who is immobile. We're not going to be able to take them to the bathroom on the
right.
Yeah.
So, normally what we're going to do is we're going to have a Foley catheter placed for urine, and we're going to have a bowel prep done before transport. So we mitigate that chance of them having a bowel movement on a plane. You cannot change a bowel movement diaper on an aircraft.
No.
People are going to want to open the windows, and that doesn't go very well at all. So, this is a bigger issue with our longer flights across the country, flights that are international. But anybody who's had a colonoscopy, will know what it's like to have a bowel prep. the day before. And that's kind of an extreme case for maybe some of our 18 to 24-hour flights. But for somebody who we're just transporting, maybe 3 or 4 or 5 hours on a flight, we'll have an enema placed, the night before flight, just kind of clear them out, and then have the Foley catheter placed. Or if it's a relatively short flight, maybe we can diaper them. And then the nurse or nurses, depending on who's going with them, can take them to the bathroom at the airports on departure or arrival.
Yeah, that's great. Yeah, that's awesome. What about, I know you talked about the bowel prep. What about meds? Say it's a long flight and they may get anxious or, hypoxic or just anxiety, something just, do you have something PRN scheduled or?
Well, when they get hypoxic, the nurse gets anxious. But as far as medications and anxiety goes, these are all the details that we work with the treating physician and the sending hospital. Many of the patients that we transport who are cognitively impaired or dementia patients, we will want to make sure that the patient has some kind of sedation if that makes them more comfortable beforehand. In many cases, our nurses will have an injectable sedative, something they can inject to the patient as a last resort.
Yeah, that's great.
Just in case. And over the course of the last 20 years, I think I've seen that done 6 or 7 times. So it really is one of those once every couple of years. But, if you have a patient who, gets out of control, which again is a very, very rare situation, you want to make sure that you can control that situation. So
well, with dementia too, the rise in dementia and people they just don't know where they are or they're confused,
Yes.
So it sounds like you guys have, there's protocols, obviously you guys have developed, in terms of the prep, before a flight, because you're in a tube for a few hours, right? So there's it's really hard to get supplies if you're not already prepared for those. So how long does it take to prep for a flight like this? So a family calls you today and says, hey, we're wanting to move my mom back to Virginia to an assisted living or whatever. Here's what's going on with her. She's got oxygen. She's got some dementia. She's got some urinary incontinence issues. How long does it typically take from phone call to now we're on a flight for you guys to go through your checklist and make sure you have everything ready?
Yeah, that's an absolute terrific question. We can go on as little as 48, 72 hours notice.
Okay.
We have people, ready to go. We have the equipment ready to go at all times. I mean, there's not a day that goes by that we don't have, multiple nurses flying around the country somewhere. What I also tell our clients is, just like you and I, if you're going to buy a ticket to fly to Florida, if you're trying to buy that last first class ticket or the last 2 first class tickets on the last flight, it may cost you a bit more than if you're buying the ticket a week out. Now, we have our own travel agency, so we do everything internally, but we're still buying tickets from American or Delta or United for the flight. So, we're subject to the same costs that the brings me to regular passengers would be.
That brings me to another question. I know some of these flights are for, because we talked before, some of these people are being transported because they're in their final days and they want to be back with family. And so, so these are kind of like hospice, hospice patients. Is there any kind of a discount that the airlines themselves offer for families that are transporting loved ones for this particular? They used to have like bereavement rates or whatever, but
they don't discount anything.
No, they don't. They upcharge. They upsell.
All right, and I have a question. So I'm thinking too, as a therapist, I've flown recently. It's really narrow, those walkways in the airplane itself, right? Where they walk into the galley or even down the rows. If you've got someone who is kind of wheelchair bound, that requires, it's a heavier lift, do you guys have transfer equipment that you guys bring to the airport with y'all to help with transfers like that?
One of the things I want to stress is, for both mobility and for cognitive patients, we're not taking patients down that long tube. That is going to cause anybody anxiety. That causes me anxiety sometimes when I'm back in coach. So this is one of the reasons that we're transporting patients in first class. And again, it's not just a luxury. It's not something we want to do to be fancy.
Sure.
But if I have somebody who has dementia, I want to walk on the plane. I want to turn left, or turn right, and then turn left into the seat.
Right.
I mean, I don't want to be going more than 7 or 8 feet.
It makes sense.
For our mobility impaired patients, again, we're not taking them down to row 36.
Yeah.
We're taking them to row 1 or row 2 or row 3. And to answer your question, yes, we actually have quite a lot of equipment that we use to transport patients who are completely immobile. If we have somebody who is, let's say a 220 pound, 240 pound quadriplegic, I'm sending 2 of our stronger nurses, be that men or women, with that patient. And two nurses can manage almost anything.
Yeah. Are they manually lifting them, or are you guys using like a Hoyer lift or a Sarah lift or something?
We have special comfort carrier slings designed for us.
Great.
That are manual, but they're very much like a Hoyer lift.
That's where I was going, because I work with Hoyers and Sarah lifts, and they have a big footprint. You're probably not fitting the ones I use on tubes. No. Yeah. So I would imagine it has to be custom made for airplanes. Yes. Yeah.
Well, I'm a concierge nurse, care manager, but concierge nurse. And I had a call from a patient that needed me to fly with him to Nebraska. And I was like, yes, I need to meet with you first. And no, it's not a good day, football, whatever. So I wind up arriving to the home, and the guy was total care. He did not share with me. I made a huge mistake, but just getting to the airport, it was 3 of us. Took 3 of us, and the guy didn't weigh that much. It was probably 150 pounds, but it's a lot of work. People don't realize, like these guys at the airport were just working up a sweat getting this guy into a seat, So what you do is very valuable. And so, and what I see too flying now, because I do fly a lot, there may be 10, 12 people waiting in wheelchairs to get on a plane, and they're solo. They don't have anybody with them,
Yep.
So,
see a lot.
Yeah, you see a lot of that. So let's talk about hospice, because you and I both love hospice. I'm such an advocate for hospice care. So when somebody calls and says, my dad keeps saying, I want to go home, we all know sometimes they're talking about their spiritual home, but sometimes they're talking about going home to their home with their children or wherever that may be. And so is there a cutoff? Because I know when somebody is starting that dying process, and it can go pretty quickly, what is your protocol to allow a hospice patient to get on a plane with your staff?
One of the first things that we're always doing is we're working with the patient's treating physician, whether that patient is in hospice at home, if they're in an inpatient hospice, or if they're in a hospital. And it is actually the treating physician's decision as to whether or not that patient is fit to travel, to fly on a commercial airline. We guide them through the medical clearance process for international flights. And our flight coordinators, who are all flight nurses, will also be working with the doctor, the nurses, the physical therapists, who are dealing with the patient, so we can get a good picture and say, hey, is this somebody who is fit to travel? Somebody who, you're expecting to pass in the next 6 hours is certainly not fit to travel. One of the things that we discuss with the physicians is when they say that the prognosis for a flight is good, that's not guaranteeing that nothing's going to go wrong. There's no guarantees in life, and especially with hospice. Fortunately, hospice patients are usually very motivated to complete whatever journey it is that they want to go. Many years ago, I transported a patient to the old Soviet Union, Georgia, which is in the news nowadays. And she was really quite sick. And I transported her myself simply because she was so sick and I was not comfortable sending anybody else. I'm not going to send one of my nurses to do something I'm not going to do myself. And we got there at 7:00 at night. There were 50 family members waiting for us when we got to the hospital. I said goodbye, went to my hotel, swung by the next morning just to check on her and say goodbye. And she had passed 4 hours after we got to DC.
Wow.
But in those last 4 hours, she was completely surrounded by her
Absolutely.
family. And there's nothing more that I can do for a human being than to help get them home to their family in their last days.
I love that.
That's beautiful.
I love to, we've talked to you, love bedside nursing and being with the patients. And, that Brian's like that too. I'm the same way. I love being with patients and with Brian, with Nexus, I'll call him, would you mind being the one to go? Even though he's got a huge staff. But
I still love it. Yeah.
I know. Yeah. It's just awesome. So how can people get in touch with you if they're interested in your services?
Well, the easiest place to go is just our website, which is just www.flyingangels.com. What I really encourage people to do, and my preference is to Google Flying Angels Philadelphia, because we are incredibly blessed with the reviews and the things other people have said about Flying Angels. I can speak for hours on how wonderful our service is, how terrific our clinicians are, and how cost effective our service is. But when people hear that from our clients, that means a whole lot more to me.
Agreed.
So as with any company, just Google the name of the company and the name of the city. Now, we're in Philadelphia, so just Google Flying Angels Philadelphia, or just go to flyingangels.com.
Yeah, right. That's awesome. So I want to touch, I know when I met Karen, your marketing director, she told me a story about a gentleman that was celebrating. He was an immigrant, came to the United States to make a better life for his family, and was partying on July 4th and got hit by a truck and became a quadriplegic. And you all worked with the hospital and got him home. It's an incredible story. So tell us about that, the listeners.
This is actually a very unfortunately common scenario for us, that people come to the U.S. For whatever reason, and they wind up having an injury or get sick or something happens, and they wind up in our healthcare system, and they don't have insurance, for whatever reason, and they're stuck in a hospital. They're in the hospital ICU, and then they wind up going to a step-down unit, and the hospital is not getting any payment for this patient because they're not a U.S. citizen. So it's actually very common for hospitals to reach out to us. Once we know where the patient is going, what country they're going to go to, where they have family, and it's a very cost-effective way for us to be able to transport that person back to their home country where they have family and where they have resources.
And are most of the home countries open to taking them back?
Yes, many countries, but in Europe, where they have terrific socialized medicine systems. I'm not editorializing, but if it works for them, or even countries in Africa that may not have complicated healthcare systems, but yet they have family who can take care of them when they get there, or even South America, where they have family. Many times the people we're transporting, are here in the U.S. alone, with no family support, with no loved ones, with no advocacy.
Are there regulations or licensure requirements for you guys to do from state to state, or even for international flights? Like, how is there an issue with being covered with that?
It's pretty complicated. We have the liability and the legal aspects covered, but it's not easy. It was one of those that it took a few years to figure out how to do it.
I imagine, because so PT licenses were state by state, but I think with nurses, you guys have a compact license that cover most states. I think, right?
Yeah.
So I would imagine you probably have to have multiple licensures, state licensures for your nurses to travel, even just here nationally, right?
Well, most of our nurses have a license in a state. Yes, some nurses have compact licenses that can do that. But because we are transporting somebody under a physician's care from point A to point B, we can do that. One of the things we don't do is somebody will say, "Can you go with us and be a nurse on vacation, in Florida?" That we can't do because I'm a Pennsylvania registered nurse. Yep. I can't take somebody to Florida and practice nursing.
But for the transport time, you guys are covered for that. But anything after that is where I got you.
Exactly.
Okay.
So, we have to have this is where we're picking up the patient. This is where we're receiving care.
Yeah.
And, this is where we're handing off care to either another, medical professional or a family member, be it here in the U.S. or be it overseas.
Well, and what a lot of people don't know is there's so many hospices that, it's paid for by Medicare. So let's say a patient is in Texas going to Florida. We will find a hospice in that area. And so they already know that somebody is coming on service, which I think is so great too. So you're communicating on both ends, that they're going to have that care, the medication they need, supplies, et cetera,
That's great.
Yeah.
Awesome.
Yes.
What a great service.
I know. It's awesome. So how can we help you get the word out? Because I think this is such a great service.
Well, if I may, one of the things that I want to discuss is there's a lot of confusion in what we do. So we're flying angels, and we have doctors and nurses who fly on commercial airlines. People often think of Angel Flight, which is a terrific organization. They are a charity. They're the private pilots who have their own planes. They fly people around for cancer treatments, a lot of children. But they can't transport anybody who has medical needs. They're limited to people who can get in and out of a small plane unassisted, which is one of the reasons that they transport a lot of children because they're traveling with their parents. And then at the other end, you'll have some of the air ambulance companies, which are the Lear jets and the private jets that fly people who need that ICU level of care. Mm-hmm. What we do is we kind of sit in the middle of it. We're not a charity. We're professionals, but we're providing medical care to people who don't need that ICU level of care that a private air ambulance would provide.
Makes sense.
Yeah, that's
thanks
great.
for clearing that up.
Yeah. Well, I just wish you that I will spread the word for sure. And I look forward to seeing Karen next week at the conference coming up in Texas. And we just wish you the best. Thank you so much. This was great. Great information.
Well, thank you very much.
Thank you, Bob.
It's been a pleasure being here.
We appreciate it.